And we're back with more of what's going on. Good eye care, very important, and the folks that do a good job of helping all of you do all of those important things for your eyes, the folks at the Tiani Eye Institute. Dr. Peter Joson back with us today, and Dr. Joson, we talk about procedures that require surgery and things that have been ongoing for years. Somebody finally realized they need to get something dealt with, cataracts or whatever it might be. But sometimes we have emergencies. Things happen to our eyes, traumatizing things. And today I think we're going to talk a bit about when we should come and see you on an emergency basis and when we should just make an appointment, regularly come on in. I guess the biggest thing would be, something that we notice something has changed.
Correct. So sort of the prompts to have you give us a call, or anyone in an emergency situation, would be eye pain and vision loss. Those are sort of real emergencies that need to get addressed quickly.
I guess there's lots of things that can irritate our eyes. Certain products. Some people have really strong reactions to things like bleach.
For sure.
Or obviously, you go to like some of these gas stations and places that sell batteries. They have these little eye wash devices right there on the spot in case somebody should get some products in their eye so they can rinse them out. But some of the things that would get in our eye could be something that would require first aid.
Correct. So, the eye is exquisitely sensitive to anything that touches it. There's like 150 times more nerves on the cornea, the front of your eye, than anywhere else on the body. So if you get a foreign body in there, it's very annoying. And also just, you said chemicals are important things to get out of the eye immediately. So common thing is like just household bleach, household cleaning products have a lot of bleach. They're called bases, and they're very dangerous to the eye. Really, the first aid starts at the home. You really need to start flushing it out with just regular water.
Yeah.
But if you happen to be at a work site and something gets in your eye, they do always have these eye washes and whatnot.
Yeah.
Other common injuries are, we see this a lot in people who are hammering or grinding metal, plumbers, or, just people at home doing their do-it-self stuff, working on the car.
Yeah.
They hammer something, a chunk of metal gets in their eye, just on the surface of the eye, but it never gets off, and it can actually form a little rust ring there. So they don't have to come in right away, but they do because it's so annoying to them. And here's a picture of one.
That's actually rust?
That's actually a piece of metal, and then underneath there's some rust.
Wow.
Yep.
So that would have to be probably put them under and take that out.
Well, we actually just do it at the office.
Really?
A slit lamp, just a drop of anesthetic, and then I just use a little like a little hockey stick and just pick it out.
Okay, very good. Now, something that might not be like a burning sensation from like a product or a piece of metal in the eye, but just vision loss and it hurts.
For sure. So there's vision loss with pain and vision loss without pain. And we'll go over vision loss without pain. First, we do just something like a retinal detachment. The retina is the wallpaper that lines the inside of the eye.
Right.
If it comes off, you'll lose vision. Also, a stroke in the eye. You can just actually have loss of blood going to the eye. The eye's a very hungry organ, it needs a lot of blood. And if it doesn't get any blood, it can't work, can't see, and it's painless, but you'll lose vision rather rapidly. Other things that can cause central loss would be macular degeneration, going from the dry type to the wet type. So those would be your major problems.
All right, and then of course, the pain aspect, obviously, the pain's going to be irritating, but finding out it's localized in your eye, and it may not be, it may be a migraine, right?
Correct. So there's pain definitely from the eyes, pain outside of the eye. It feels like it's coming from the eyes, certainly like a headache. So vision loss with pain, a corneal abrasion, so a scratch either from a paper cut or a baby's fingernail. So many things can hit the eye. That's exquisitely painful. Once again, I mentioned there's a lot of nerves there. And here's a picture on the top where someone had something underneath their lid, and every time they blinked, they were scratching it.
Yeah.
So those green marks are actually when we put a dye in there and it stains the scratch green. And if it happens to be right in the middle, their vision will be affected, obviously.
Yeah.
On the bottom, there's a slide of someone who was probably wearing contact lenses, probably got a scratch, and they got infected. That's called an ulcer. And that can be relatively harmless, but if untreated for a while, can lead to devastating vision complications.
Right. A lot of people do wear contact lenses, and I know, having worn them in the past, at least a little bit of grit or dirt, you really feel it rubbing on your eye.
For sure.
So yeah, that could be very painful indeed. But something could be even more serious in these surface issues. You mentioned macular degeneration, and you also mentioned that there could be some things going on the back of the eye.
Correct. So there's also vision loss with pain. There's also glaucoma. You can get a glaucoma attack. And typically those occur when you're going from a light place to a dark place. The classic teaching is a movie theater. I think that's on the next slide, actually. And then the worst thing could be problems with the back of the eye. We talked about macular degeneration. We also talked about the nerve getting a stroke in it.
Yeah.
even optic neuritis, which is a precursor for multiple sclerosis.
I guess what it sounds like, whether it hurts or doesn't hurt, if you notice major vision changes, it would be the time to call, what, 911, call your office? What's the best
I wouldn't go to an
response?
emergency room or go to 911. I really just go to your ophthalmologist, because oftentimes you'll end up going to the emergency room waiting 4 hours. They won't know what's going on and refer you to the ophthalmologist straight away. So if you have an established relationship with an ophthalmologist, it's best to just go directly to them.
Something that may not be as invasive or as painful as some of these things, but some people get a lot of red eye. And there's products I know that on the market that claim takes the red out of your eye. What's the cause of that? Is that just more blood in your eye? Or?
A lot of it, when the blood vessel's all red, it's just dryness, quite honestly. Sometimes it can be allergy. And Visine's okay to use periodically if you're going out on the town, you don't want to have that red look. But really, the Visine chronically used is an awful thing to do, because the way it gets the red out, it actually shrinks the blood vessels. And I tell patients, don't you want to get blood to your eye? It kind of needs to have blood to work. So I would just recommend using tears to get rid of that redness.
The liquid tears type of product.
Correct. But a common complaint is when someone gets a burst blood vessel, the white of the eye certainly turns red, and it looks very alarming and scary. And I probably see someone like this every day. They come in right away saying, my eye's red, please help me. And I tell patients, my dad gets these periodically. They look terrible, they look awful, but there's no concern. It's like a bruise of the eye.
Right.
As long as they don't bleed easily and their gums are bruised easily, maybe they're on aspirin or Coumadin, it could just be that.
Right. We've heard of something called pink eye, and I know that used to be a big thing that kids would always, rub their eyes or whatever, and they'd come to school with all this bad things happening.
Correct. So pink eye is usually infectious, and in children it's almost always bacterial. So we do treat them appropriately with eye drops. However, in adults it's almost always viral. So it's like the common cold. People demand antibiotic antibiotic eye drops, and I tell them, just like if you have a cold, most of the time your primary care provider won't give you pills. I'm pretty hesitant to give adults antibiotic eye drops for pink eye, because like I said, most of the time it's viral, self-limited, goes away in about 7 to 10 days, and just symptomatic relief with tears and cool compresses usually do the trick.
And it isn't threatening to your vision?
No. If you have persistent pain and discomfort after the redness is over, you should come in, but most of the time it's very self-limited.
Okay. And not to be confused with red eye that we talked about before, which is that blood vessel issue. Pink eye is the infection thing.
Correct. They'll have a lot of redness, crust, discharge. Those are the typical signs.
People have what they describe as floaters and flashes in their eyes.
Right.
Is that cause to be concerned?
Well, it can be. So the floaters are just a natural aging change. I even have some myself just from being very nearsighted. One day, if you live long enough, typically in the 60s and 70s, you'll have this really big floater. People describe it like there's this big gnat or fly in their vision they want to swat away.
Yeah.
And it's actually when the jelly in the eye, called vitreous, fully melts and just leaves its residue right in the middle. Now, physically, that'll always be in their eye, but over the course of a month, they'll just see it less and less because their brain gets so annoyed by it. Now, sometimes when that jelly comes off, it can tear or rip the retina, and they'll see flashes. A couple flashes as it occurs is okay, but if the flashes are persistent and they don't go away, that should prompt them to come in to see their ophthalmologist to make sure there's no tear or rip in the retina. Yeah.
And I know that's when you like to dilate and look really deep into the eye with that really bright light.
Exactly.
It's not the most comfortable way to
Not at all.
examine, but that's the only way you can really see back through the eye into the retina.
Yes, I do a thorough exam. I tell patients it's like flying, your helicopter all around the landscape to make sure everything's where it's supposed to be.
Right. Well, if you think you have some issues with your eyes and you want to find out more, of course, you can give them a call over there at the Tiani Eye Institute, and whether it's a procedure or just a good healthy eye checkup, you folks can provide all of that as well.
We're here for you. Yeah.
Very good. Dr. Joson, thanks so much for joining us today on the program. Again, that's the Tiani Eye Institute. Some great services available right over there, so check it out. And again, if you have these emergencies, your ophthalmologist is probably your first course on something like these things we've talked about today. We'll be right back with more after this brief time out.